we're actually
I'm looking at Chicago
was
weather. It
baptized
says
in Missouri Center.
chance of snow is 10%. So it looks like
They should be dug out.
it should be dug out by then. I'm hoping.
Yeah, I was in ALC for a little
I got
while.
3 days
I
to
just-
do it. Friday,
Things
Saturday,
kind of went
Sunday.
downhill, and then it was like,
It's a long way to go.
That's exactly what happened.
I'll drive to Chicago,
Because
man.
the ALC church we belong to is fairly
Wouldn't help me.
conservative.
Chicago's closed.
All right, it's about that time.
It's okay, get out.
I'd drive to Detroit, fly from Detroit to Fort
I would like to call this meeting to order, Wednesday, February 5th, Public Health and Safety. And if we could all rise for the pledge, please. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. Jackie, would you call the roll?
Commissioner Rennie?
Present.
Inman?
Commissioner Inman is excused. He wasn't feeling well.
Thomas? Wheelock is excused as well. Lemkool?
Here.
Lathrop?
Here.
Chairman Maxbauer?
Here. At this time, I would entertain a motion for approval of our minutes of January 8th,
Motion to approve.
supported by Dr. Lathrop. Discussion? All those in favor, say aye.
Aye.
Opposed? Motion carries. This is our opportunity for public comment. Jackie, if you would read the rules, please.
Any person shall be permitted to address the meeting of the Board of Commissioners, which is required to be open to the public under the provision of the Michigan Open Meetings Act. Public comment shall be carried out in accordance with the following board rules and procedures. Any person wishing to address the board shall state his or her name and address. No person shall be allowed to speak more than once on the same matter, excluding time needed to answer commissioners' questions, if any. The chairperson shall control the amount of time each person shall be allowed to speak, which shall not exceed 3 minutes. The chairperson may, at his or her discretion, extend the amount of time any person is allowed to speak. Public comment will be solicited during the 2 public comment periods noted in Rule 5.4 Order of Business. However, public comment will generally be received at any time during the meeting regarding a specific topic currently under discussion by the board. Members of the public wishing to comment should raise their hand or pass a note to the clerk in order to be recognized and shall not address the board until called upon by the chairperson.
Would anyone at this time like to make public comment? Seeing no one, next item on our agenda is approval of the agenda. I have 2 items that I would like to add to the agenda. One is in-home services presentation by Commission on Aging. That will be under number 2, under Department and Other Action Items. And also, under new business, we will briefly discuss a joint meeting with the Commission on Aging Board. With those 2...
We also may want to change the cross-jurisdictional because she will not be here until 6:30, so we may want to put her after Dawn's presentation. So just to switch those 2.
All right, we will do that. With those changes, I would entertain a motion to approve the agenda as amended.
I make that motion.
Moved by Dr. Lathrop. Is there support?
Sure.
Supported by Commissioner Thomas. Discussion. All those in favor say aye. Aye. Opposed? Motion carries. Next on our agenda is the consent calendar. Jackie, your turn again.
The purpose of the consent calendar is to expedite business by grouping non-controversial items together to be dealt with by one commission motion without discussion. Any member of the commission, staff, or the public may ask that any item on the consent calendar be removed and placed elsewhere on the agenda for full discussions. Such requests will be automatically respected. If any item is not removed from the consent calendar, the action noted, receive and file, or approval, is approved by a single committee action adopting the consent calendar. A. Receive and file. 1. Community Corrections Report for December of 2013. 2. Commission on Aging Program Report through December of 2013. 3. Veteran Services Monthly Activity through December of 2013. B. Approval. 1. Commission on Aging Bylaws. 2. Commission on Aging Report of Donations for 2013.
All right. Would any member of the public like anything removed? Any member of the board? Commissioner Rennie?
A2.
A2. Anyone else? All right, I would entertain a motion with, to approve the consent calendar with the exception of A2.
I'll make that motion.
Moved by
Support.
Dr. Lathrop, supported by Commissioner Lemkool. Discussion. Roll call, Jackie.
Commissioner Thomas?
Yep.
Lemkool?
Yep.
Lathrop?
Yes.
Rennie?
Yes.
Chairman Maxbauer?
Yes. All right. That will bring us to items removed from the consent calendar. That would be item A2. Commissioner Rennie, you have the floor.
Is there anyone here from Commission on Aging?
As luck would have it, we have 3 people from Commission on Aging. Who would you like to hear from, Commissioner Rennie?
Whoever wants to speak, but they should get up at the podium, I think.
Georgia and Holly, if you would introduce yourselves, please.
Georgia Durga, Director, Grand Traverse County Commission on Aging. Holly Dewalt, Deputy Director.
Commissioner Rennie?
Yeah, I only have one question, and I'm looking at your wait lists. And I see a big wait for lawn service, which makes good sense. But I see a lot of wait lists for snow, where people are ready and not getting this service, I presume.
Correct.
Very tough year for snow, especially on old people. You have a pretty big fund balance, we approved. Why can't we work on that wait list?
Well, actually, we've just started looking at, we have a finance committee, we have a program committee. The program committee has asked our finance committee to look at what kind of funding would be available to address not only that, but any other services where we might have a wait list. So we've just started looking at that to see what kind of money they can come up with. So,
Do you feel these numbers are large?
for wait lists,
Yeah.
yes. We used to have 1.8 FTEs more, but in the 2012, when we had a large budget cut, we eliminated those 2 positions through attrition, and we never replaced them. So at some point in our budget, you know, our position numbers were adjusted by the county board, and our budget was adjusted down to reflect those. But I think that's one thing we should look at. That would take, I think one employee is about 50 to 60 clients. So we could probably take at least 100 plus off the wait list.
Do you feel like we have a hard winter like this, you could outsource some of this work, or just
We've-
to catch
we-
up, that sort of thing? Or
We looked at that last year, and it was determined, I don't know how accurately, that it was less expensive to keep it in-house, and then we never went any further with it. But I think that's one of the other things. Once they decide how much money we have available to spend, they will look at all options. Outsourcing was talked about, employees were talked about, temporary employees, like someone
That
through
sort of thing.
Manpower was
Yeah.
talked about. We've used Manpower people before. Sometimes great, sometimes not so great, but we have looked, I think we'll be talking about a lot of different options. But, you know, if you have any other ideas, we are open to looking at anything, I think.
Well, the important thing for me would be that you are looking at it to try to reduce it. 100 people, it's a lot of
That's a
people
lot.
that have snow issues.
Yep.
Thanks.
Commissioner Lemkool?
Yeah, I think it's really important to note that even our road commission hires temporary employees for the summer, for the wintertime from contractors that are already, these people are already, you know, very knowledgeable about how to do the job and everything else, and working with a contractor to be able to provide some of those things. Personally, when we did this, looking at whether or not it was feasible or not feasible, I really feel that the bidding was not done with apples and oranges. I think it was done with apples and grapes.
It was
So-
really hard to do apples and apples.
Yeah, well, it needs to be done with apples and apples, and you need to actually go out and ask for, you know, I have 10 people that need this job, and, you know, what are you gonna charge me for doing it, and then put it in your budget? That way you can take care of your wait list. So, and they're all busy this time of the year, but, you know,
Yep.
I'm sure there's companies there that would be willing to pick that up.
All right. Well, the Finance Committee is going to be looking at that. With that, I would entertain a motion to receive and file the Commission on Aging Program Report. Moved by Commissioner Rennie. Is there support?
Yes.
Supported by Commissioner Lemkool. Discussion. All those in favor say aye. Aye. Opposed, same. Motion carries. All right, next item. Northern Health Care Management Agreement Clarification, Commission on Aging. Georgia and Holly, you might want to just sit in the corner chairs over there. You have the floor.
Yes, thank you. So this issue, we came before you back in December, I believe, to talk a little bit about the Northern Healthcare Management request to contract with them for the My Choice Waiver Program. And as you'll see kind of through this recommendation, I really feel like there was some information that we didn't clarify well to you when we were before you previously, and so really wanted the opportunity to do that tonight. So the issue, I think, that came forward, or the question was with regards to our unit costs and how much we're being reimbursed for these programs. And the piece of information that I don't feel like that I was really clear about was the fact that the individuals who are eligible for this program are also Medicaid eligible, which means that those clients, if receiving services through the Commission on Aging alone, would be paying either $2 or $5 an hour. Through this contract with Northern Healthcare Management, we're reimbursed at $16 an hour. So it's a significant difference, although no one is paying the unit cost because the majority of our clients are paying on the sliding fee scale wherever they end up. So I really felt like that was an important piece that I didn't clarify well to you the last time. So I really wanted to be able to bring that back tonight. I don't know if there's anything else, Georgia, that you wanted to add.
Northern Lakes, Northern Healthcare Management, they have solicited us. I mean, they want to work with us, and we want to work with them. We already work with the area agency in the same capacity. Area agency reimburses a little bit higher, but that is not much higher. But that's an organizational thing that they decide, I think, internally. And so our relationship with the area agency is good right now, and we don't really have much of a relationship with Northern Healthcare Management, but we would like to have one with them. So I think it would be nice, since they reach out to us, if we could serve them. The other thing is the continuity of care for our clients. Right now, if we don't work with them, one day they're going to have one of our workers, then the next day they're going to have somebody else, then they might have us, and they're going to have somebody else. Where if we work with them, they can have the same worker come in every day, which if you're getting a bath, it's kind of nice to have the same person coming in.
Commissioner Lemko.
I'm the one that brought this, the question on it was the fact that when you're getting reimbursed for $11 an hour plus $2, you're still way under what your cost for your employees. And that was my biggest concern, is that you're leaving money on the table because they're not going to be willing to reimburse you for your normal wages. And when you don't get that, then shame on us. Because that's one of the things we're trying to go through with our budgets, is to make sure that we're getting paid for services rendered. And it's really important that we do it. And that's why I voted against it. And I still don't. Now, I understand what you're saying about getting the same person, and I understand all that. But on the same token, if they're not willing to reimburse you for your cost, then we shouldn't be part of it. And this is the federal government trying to tell us that we got to have competition. There are other organizations out there that may be able to afford this kind of a give back as part of their budget, but we're not there. We have budget constraints, we have budget concerns, and I don't think we can continue to provide services for an organization that's not going to pay for our time and wages.
But now, I want to see if I heard you correctly, Holly. Those clients are using our services anyway.
They are. That's a clarifying point.
And from those clients, we get, depending upon
$2
the
or
service,
$5.
between $2 to $5 an hour from those clients.
Correct.
If we go through Northern Healthcare Management,
We're now being reimbursed at
we now get
$16
$16 an hour instead of the $2 or $5 an hour from the client. So that is in our taxpayers' interest, our millage ratepayers' interest to go through this agreement. Is that what I'm hearing from
It
you?
is, correct.
Okay.
Okay,
And we didn't really explain that very well the last time, and that's why we wanted to come back and.
all right.
So,
Well, that makes more sense.
all right. So this is really to our, not only our millage payers' benefit, but our clients' benefit.
Absolutely.
All right. I would entertain a motion. Commissioner Rennie.
I'll make the motion. You
To
want me to read it?
approve the agreement.
Yes.
Is there support? Supported by Dr. Lathrop. Discussion. All those in favor say aye. Aye. Opposed, same?
Aye,
You're a no?
I am.
All right.
That's all right. You
Jack?
don't need to do a roll call, just,
All right. Next on our agenda, in-home services presentation by Holly.
I'm number 2 there. I wasn't
You are.
sure. Thank you.
Don't go far.
Thank you. I really wanted the opportunity to kind of come in front of you tonight to just give you a quick overview of in-home services. I know my counterpart, Lori, was able to kind of come in and talk to you a little bit about the Senior Center Network probably about 6 months ago, and the timing just hasn't been right. So I'm here today, and it's kind of a nice wrap-up to 2013, so I won't take a lot of your time. I did put on your tabletops a little packet of information to kind of tell you what I'm going to talk about. I gave you a copy of our brochure, and then a copy of our most recent newsletter as well. So you have that. I guess just by starting, and also to clarify for the viewing audience, that the Commission on Aging is broken into kind of 2 different divisions at this point. I'm going to be talking about the In-Home Services Division, which is the division that I oversee, and then we have the Senior Center Network. So I'll be focusing on in-home services tonight. I included the mission statement, which I'm going to read quickly so that the viewing audience, again, can hear what our mission is. The mission of the Grand Traverse County Commission on Aging is to offer home and community-based services to maintain and improve the quality of life for resident senior citizens. So it's a mission statement that we really, our board worked on and the staff worked on to kind of bring that up to date so it would encompass both in-home services and the Senior Center Network. So I thought it was important to share that tonight. Just to give you a quick overview of my role as the Deputy Director overseeing the In-Home Services Division, I supervise 3 office staff, so in that space, 2 supervisors, and indirectly 31 field staff that work out in the field. As most of you know, our clients are people who are residents of Grand Traverse County. They are required to be 60 years old or older. And I think it's interesting to point out as well that we are providing services. I was talking with the supervisors today, and we actually reach to every neighboring county line, you know, for as far as where our services go. So when we say we cover all of Grand Traverse County, we truly are covering all of the county. I'm not going to go over a lot of statistics because you get the program reports and you're able to look at those. They're available online for anyone who would like to see those. But a few interesting statistics to point out. In 2013, we provided service to 1,703 unique individuals. So over 1,700 people the Commission on Aging directly impacted and touched. So I thought that was a good number to share. Just to go over a little bit of our core programs with you, and then I'm going to kind of tell you what our typical parameters are for those programs. Sometimes those parameters vary, but just, and also so the public knows what is available. We do house cleaning, and that is light house cleaning. You know, we're doing bathrooms, sinks, floors, washing down walls, dusting, those kinds of things, and typically we do that 2 times a month. So it's a service that's provided every other week. We have 13 staff that are going into the homes and providing that service. We have home health care and respite I'm going to kind of put together because we have 10 staff that are certified nursing assistants that provide that service to those people. Home health care, we're doing personal care, like assisting with showers, we're doing skin care, we're checking vital signs, those kinds of things. Typically, home health care visits are done 2 times a week. And then with respite, it is care that is provided to relieve a caregiver. So for someone who has a 24-hour caregiver, we will go in and usually do about 4 hours a week. Sometimes that's in a 1 hour or a 4-hour block. Sometimes that's 2 hours, really depending on what the need is for the person we're assisting. We do in-home foot care. We have one foot care nurse, and she goes into the homes for people who are homebound. And we usually see people about she sees people about 6 to 8 weeks, depending on what their needs are. So we do have one foot care nurse. And then we have the outside home chore program, which includes lawn mowing and leaf removal. And those are really combined as kind of one program. So if you get lawn mowing, leaf removal is provided to you also in the fall. And this year, we're doing leaf removal still in the spring because the snow came so soon. So we have several lawns that didn't get their leaves removed because the snow came so quickly. We also do windows in the spring and fall, and then snow removal. We have 6 full-time staff in that program that provide those services. And the typical parameters of that program really vary according to what service we're doing. But since we're in snow season, I kind of provided you with a little bit of information just to tell you, in December of 2013, we did 1,426 visits of snow removal. And in January, we did 1,448 visits. So we're doing a lot of snow removal this winter, as is everyone who lives in Grand Traverse County. Those staff in that program, those 6 staff see, we kind of have the snow removal set up so that the clients know most of the time when we're coming. So most clients are either a Monday, Wednesday snow removal, or they're a Tuesday, Thursday. Each of those 6 staff will see 30 people on Monday and Wednesday, and then they do snow removal for 30 more people on Tuesday and Thursday. So each of those 6 staff carry a caseload of about 60 people each, okay? And then through those core programs that I listed, in 2013, we provided 37,473 hours of service. So that's a pretty impressive number. So I just wanted to kind of point that out because it's not exactly, you don't grab that exactly from the program report. We also have loan closet where people can borrow things from our loan closet. We have walkers, bath benches, bedside commodes. We have 500 units of personal emergency response units, which are the buttons that you wear around your neck or on your wrist that you can press if you have an emergency. So we have 500 of those that we provide. We have a transportation program where we do beta passes and transportation coupons, and they're available on our sliding fee scale. This program has really been well received, and really in working with other senior groups, it's really, transportation has been an area that's really been identified as a need in Grand Traverse County for seniors, especially something affordable. And we've been fortunate to be able to continue this through donations that we've had, most anonymous. So we've been able to kind of move forward with this. And I did tell you also in 2013, we provided 3,142 transportation units. So that's a combination of beta passes and coupons. I'm sorry, I heard you look like you were going to ask a question. No? Okay. Then we also do information and assistance on an ongoing basis where we provide referrals to anyone who calls. We have heat assistance money available. We also do home-delivered meals to seniors for the NMC barbecue in May. Baskets of Bounty, which some of you are familiar with. We delivered 100 baskets this year around the holiday season to people who express need, and mostly those who are alone for the holidays. We also do an intergenerational card program where all of the schools in Grand Traverse County make cards for seniors, and we deliver those around the holidays. We have a couple programs through AARP. We offer driver safety, and right now we are in the midst of tax season. So again, for the viewing public, we are taking appointments for simple tax returns, and it is at no cost. So you could contact the Commission on Aging office. And then also we administer money for BASA, which is the Bay Area Senior Advocates Group, and we received $16,000 this year to administer, and that is for emergency situations that arise where people may not be able to get assistance somewhere else. So we do that as well. And then really I just want to close kind of by giving you a little story about who Commission on Aging clients are. They obviously are Grand Traverse County residents, and I'm going to kind of give you a quick story about a resident, a Grand Traverse County resident, who started services with us 12 years ago. And at that time, they were just receiving snow removal. They slowly added house cleaning, lawn maintenance, and home health care over the next 6 years. And in the next 5 years, they added Personal Emergency Response Unit, the button, so they could call for help when they were alone. In the last year of their life, they asked the Commission on Aging to provide respite services because this client had to depend on living with her adult children near the end of her life. And in the last 3 months of her life, the Commission on Aging was able to accommodate respite care, and we were able to do that between her 2 adult children's homes. And so she recently passed, and the family really couldn't express enough to us about how we were able to really provide dignity and respect to this client, because she really wanted to be able to stay home and pass at home with her family. And the family really shared that that would not have been possible without the Commission on Aging. And so they've said a lot of lovely things about our employees and identified the Commission on Aging for memorial contributions. So it's just kind of nice to hear about the people, too. So I'm happy to answer any questions. Yes?
Commissioner Lemkool.
Yeah, I got stopped the other day from one of your clients, and he said he would not be able to survive today without the Commission on Aging report coming into his house twice a week to take care of his wife, because she's got Alzheimer's.
Yes.
And he said, I want to adopt her.
We have
So,
some phenomenal employees.
He was so impressed with the
carrying that.
employee, and that he said, it was just, and he was grocery shopping. He would not have been able to go grocery shopping
Right.
without that respite care to be able to come in, to be able
It's
to help take care of
important.
it. The other question I have is on heating assistance.
Yes.
And I don't know if it's possible. We've had some huge jumps in propane. And I don't know if it's possible for you to look at doing a contract at the beginning of the year with a propane supplier to be able to take care of your needs, so you can buy it at a cheaper cost, because everybody takes and pre-buys their propane.
Sure.
They get the cost, and they get, if you're on a per time, then you're going to pay the higher rates. And I'm just wondering if it's possible. You might want to look at it.
Sure, I think it's
To be able to
certainly always
say,
worth exploring.
We know we're going to have X number of propane users.
Right.
We want to be able to be you, our supplier, and so we want to be able to get a price up front in the beginning of the year, so you will be able to take care of our clients' needs as they need it.
Yeah, I think it's
Just-
absolutely worth
just a thought.
exploring and seeing if it's an option.
Commissioner Rennie.
Yeah, interesting, I got a load of propane myself yesterday, and we had froze the price. It was
Did you
around
cough?
$1.09. When he told me that people are paying on the open market $4 a gallon,
Yeah,
I
Wow.
coughed.
yeah.
Yeah. So
Yeah.
set that price, I think it's a good idea.
So it is something they offer to private.
Yeah, I'm not sure how you would set it
Yeah.
up, but for a private person, you had
Yeah, I
your
don't
account,
know.
you start that in the fall, actually.
Sure.
Yeah.
Anything else? Thank you for your time this evening. I appreciate it.
Thank you. All right, next on our agenda, Northern Michigan Cross Jurisdictional Sharing Team.
Yeah, she's here.
Yes, I saw her
Oh, good.
arrive.
Okay.
So I thought we would just go ahead with the schedule.
Hello, apologies for being late.
You're right on line.
Okay, great. My name is Jane Sunmacher, and I'm the Community Health Planner for the Health Department of Northwest Michigan. We serve Antrim, Charlevoix, Emmett, and Otsego counties, and we applied for a grant, which is why I'm here today. It's from the Robert Wood Johnson Foundation, which is the largest health-related foundation in the world. And it was quite a competitive process, and we were thrilled when we received the funding. We're at the end of our second year, and we have a steering committee that includes the health officers from 6 local health departments, and so that includes Wendy here. And it also includes the chair of the Board of Health, and Herb Lemkool, Herb. And we've been meeting over the past year or so to look at the different ways that local health departments can work together to increase efficiencies and actually improve the health of our constituents. And I just wanted to share a little bit about what we're doing, because the the Center for Public Health Sharing, which is the organization that manages our grant, really feels that policymakers and elected officials are often left out of these conversations that local health departments have, and are really encouraging us to get out and talk to local boards of health and the Health and Safety Committee. So I have a little PowerPoint presentation. I just have the handout that I'm going to go over with you. And if Wendy or Herb want to pipe in at any point, I'm very casual, so go right ahead. So the cross-jurisdictional sharing team is one of 18 what are called learning communities across the country. And as a matter of fact, I was just at a meeting in San Diego, which was fabulous for lots of reasons, with all of the different learning communities. And what we're really doing is figuring out what works in cross-jurisdictional sharing so that we can take all of the learnings, that's what they call them, learnings, and share them with all the other local health departments across the country so that they can start to take advantage of some of the things that we've learned over the course of these 2 years. There's 6 local health departments involved, so it includes Grand Traverse, Benzie Leelanau District Health Department, number 10 to the south, our health department, District 4 and District 2. And when I was writing the grant proposal, I wanted to have a way that I could describe exactly how big this region is to the readers in New Jersey. And so I came up with the measurement that these 25 counties are about the same size as the states of Connecticut and Massachusetts put together. So it is a large area that we're talking about. Our goal is to explore cross-jurisdictional sharing arrangements that will increase efficiency and enhance public health access all across northern Michigan. Now, these 6 local health departments have a really long history of working together. I joined the health department in Northwest Michigan about 20 years ago in order to work on a major regional community health assessment project that included these 6 local health departments at the time. So I know that they've been working together for a long time. There's a lot of, well, not a lot, there's about half of the 6 health departments are quite strong, and the other half are really not as strong. And so there's a mix of representation there. And so we're really thinking that by working together, we can really create a stronger public health system across the region. You know, we work very closely with hospitals, and actually they're represented on our team. And, you know, hospitals' service areas don't really recognize the jurisdictions of a local health department. And so if we really want to work together in order to improve public health, we have to work across jurisdictions. So we've got a bunch of activities that we've been working on. The first one is completed. We did conduct a thorough assessment of all of the different cross-jurisdictional sharing arrangements that are already in place. We're working on developing a strategic plan right now. We're looking at a review of a bunch of different kinds of cross-jurisdictional models, and we're going to be deciding which of them that we're going to implement. When we first started this project, we weren't really sure if the local health departments were even going to be interested in working together in a cross-jurisdictional way, but they most enthusiastically are. And then one of the things that all of the funded communities have to take a look at is applying for national accreditation through the Public Health Accreditation Board. And they're asking us to look at doing some joint applications. So we're going to be doing that. And then finally, we're going to be assessing the ability of each local health department's capacity to conduct the 10 essential health services. And I'm not going to go into this, but the 10 essential public health services are really along the lines of assessment, policy development, and assurance. The results of the assessment, I don't think will be a surprise to any of you. When we discovered that policymakers like you serve roles as decision makers about cross-jurisdictional sharing arrangements, provide oversight. Lots of times you can be an advocate for a certain project, and are also members of a governing body. There's lots of different types of governance all across the country. It's been really interesting to see how different health departments are set up. And what we discovered is that all of the 6 health departments are sharing to a greater extent than ever before. That most of them are what are called informal arrangements. At one end of a spectrum is kind of an agreement to, if somebody comes into our health department and wants an immunization, you'll give it to them. If they come into ours, we'll do it, we'll provide the immunization, all the way to deciding that you want to merge with another local health department. Most of the boards of health or the Health and Safety Committee approve these more formal arrangements, and they all consider cross-jurisdictional sharing arrangements to do a lot of positive things like make better use of resources, aid in recruitment of qualified staff, and to provide better services to meet unmet needs. We've also have been looking at all of the different ways that health departments work together with administrative and support kinds of services, and they tend to involve the health officer, the governing board, sometimes the state, that should be state health department, not Board of Health, and local community partners like hospitals, like as I suggested before. Many of the arrangements have in place for 10 years or more. Most of them do not have any sort of expiration date, and evaluation is kind of limited. And actually what that suggests is we really should take a look at the arrangements that we have in place and evaluate how well they're working on a regular basis. And we all laughed at the question about do you receive funding in order to plan and develop any cross-jurisdictional sharing arrangements, because we sure don't do that here in Michigan. So why should you all be interested in cross-jurisdictional sharing? Well, there's several functions of a governance body, and I'm just going to briefly go over these. Policy development was one of the areas that our team members looked at. Things like responding to new healthcare reform. They looked at resource stewardship, and these are things like sharing a medical director, like you do with Dr. Collins with the Benzie-Leelanau District Health Department. Some of the health departments also share IT services. Actually, we share a server with the Benzie-Leelanau District Health Department. And there's lots of work that all of us do over and over and over again, like write job descriptions for the same positions and put together orientation programs for the same employees, that we could really have some efficiencies there. In terms of legal authorities, when like a imminent danger order gets written in one health department, it's get reviewed by their attorneys. That's something that other health departments could share as well. Partner engagement is also something that I suggested earlier, by collaborating with different partners who cross our service areas. And continuous improvement really lends itself to the types of community health assessments that we've worked on together, and deciding to implement certain evidence-based strategies so that we know what the interventions that we're doing are going to work, and we can decide that we're all going to work on one together and hopefully move that needle. Now, the final function is oversight, and this is where the group talked about developing some common metrics in order to really assess how well we're doing as time goes by. We've developed a practical vision and identified our priorities that we're going to work on for 2014. And the top one is maternal and child health. Second is information technology, and third is an integrated system of perinatal care. And then finally, I just wanted to mention that we have a little side project going, and I don't know if it's fortunate, but the Benzie-Leelanau District Health Department finds itself without a health officer right now, and this requires a cross-jurisdictional sharing arrangement. So the Center for Sharing Public Health Services has actually offered to help the Benzie-Leelanau District Health Department take a step back and look at all the different ways that they're sharing things now. For example, share a medical director with Grand Traverse. They share billing services with District 10. They share their IT server with us. And so we're going to be starting off a whole planning process that the center developed at the end of February. And with their Board of Health and some county commissioners. And they're going to be taking a look at, is this really how we want to align our services, or is there a better way that we can do it? So that's kind of an interesting emerging issue that kind of happened as the project went along. Any questions?
Commissioner Lemkool.
It's been really informative for me to be able to be part of this as to what's going on. And of course, Wendy and I have had many discussions as we're traveling back and forth to these meetings, mostly about the Benzie-Manistee, but as to whether or not we should be looking at doing more services with them. We offer a lot more services for our county residents than they do, and so that's a challenge, and how do they pay for that? How do they really require more? But it shows the differences between two counties that may not be getting the same quality services as the counties that are. And of course, many years ago, we were a tri-county health department here. Mm-hmm. It was Leelanau, Grand Traverse, and Benzie County. And then there were some concerns as to how the services were being rendered. And so I've been really an advocate for looking at whether or not we should. And of course, Wendy and I've had many discussions about, okay, but what's in it for us? It may be that they get a whole lot more benefits than we would, so therefore, why would we want to do it?
I see Dave nodding.
Well,
like,
Dave
don't go there.
Dave and I have had these discussions also. So it's just, it is kind of one of those things that, what do you do? And what's best for your community? What's best for when we got budget concerns and how we take and support this stuff, how do we be able to expand ourselves to be able to take on somebody else's budget concerns? Which is exactly what we might be getting into. So
I see Wendy inching towards the
Oh,
microphone.
sorry. I didn't notice that.
I just wanted to add some comments. Wendy Truitt, Health Officer for Grand Traverse County Health Department. That this going through this process has been it's been really good, and there certainly are things that we can look to do cross-jurisdictionally and are already doing in the maternal and child health world to make services better and improve access. I have learned that our health department, calling us a health department is kind of, it doesn't fully encompass our whole scope.
Right.
And
You're like a health department plus.
yeah, we offer all the traditional health services, but under our same fiscal budget or fiscal umbrella, which I'll talk to you more about next week. We also do emergency management and animal control, the medical examiner. So we have, they all still align with public health and our mission, but our scope is so much broader than some of the other smaller health departments or even district health departments that are, say, multi-county, but only focus on the traditional core kinds of public health things. So it's complicated. I feel like we have we almost have, in viewing this, we almost have strong cross-jurisdictional agreements with our own county, and that we're so strongly aligned with the county here that is not typical. You know, our county IT, we have an agreement where we pay for half of an IT person to focus on our programs. We share the medical examiner with Benzie Leelanau too, but it's the counties of Benzie Leelanau, not the health departments there. So we're a little bit different, not necessarily in a bad way, we're just different. So that's part of the having to take a hard look at everything too is.
And I think it's also important to note that you as commissioners, we as commissioners, we are the Health Department Board.
Yes.
And that's why I thought it was important that we have this presentation. You know, we've been working on this for going into our second year, third year?
No, we're going into our second.
Second year.
Yeah.
So 1 year we've been doing it. And I just felt it was important for the commissioners to become aware of what's out there, what are they working on, how are we different than others, and what makes us a better health department because of what we're doing. And believe me, it's our staff. That we could not be doing the things that our staff is doing if we didn't have their support. And they also appreciate our support as to what they're doing and how they're able to provide services for our community.
We do as health departments, because public health is its own little niche in the healthcare world, we do get a lot of expertise from one another too. You know, during outbreaks, we're always working together because a lot of times people will come here for an event and then potentially go back to areas, and so we're always working together.
Right.
Anyone else? Any questions?
So we're the Board of Health.
Yes, we are.
You are. That's not typical.
No, that's not really typical. A lot of others have a separate board, like District 10 has a separate board of public health that they are managing their health department. Benzie Manistee, I think they have a separate board, or
Benzie Leelanau is.
Benzie Leelanau.
It's considered a district,
Yeah.
even though it's two. And so they have a separate board of health that is made up with a combination of commissioners and others. From both counties, is it just commissioners?
Community residents.
Yeah.
The public health code requires the district health department to have 2 commissioners from each of the counties that the district serves.
Right. So, you know, if we decided to do something with Benzie Leelanau, we would stop being the Board of Health, and we would may be a separate Board of Health.
You'd make appointments.
I don't know. Depends on how it works. But I mean, these are all questions that have to be asked and answered before you even start to do that.
Well, it's
But
the
we're-
level of service provided, too.
Yeah, we're really here tonight to talk more about the cross-jurisdictional and the whole project
Yes.
as a whole.
So, I
that's
think
a
that's,
I got to reel her in.
Good luck with that. Barb's been trying to do that for how many years
yeah,
now?
well. yeah. Wendy made the comment that she's getting to know me better than my wife as we're doing a lot of these conversations going back and forth. So I've really enjoyed getting to know Wendy and some of the things that she's doing. So it's, and also it's with all the other health departments. I mean, it's amazing what they are offering, how they're offering it, what they're doing, how prepared they are, how important they are for the people in our communities. And so we're all learning something along the way.
Yeah, I'll say Health Department Northwest really, I think, took the lead on some of the more detailed issues with the maternal and child health. And so they've really taken the lead on that, but it's just grown so much so that we're now encompassing a 21 region area that includes Munson and all the different hospitals that are part of that. And that's a big task because right now, Munson is the only northern Michigan hospital that actually has an ICU. So if someone delivers, say, over in Alpena, and there's sporadic hospitals, if you look at the map, if you live in some counties, you will have to drive an hour, hour and a half just to even give birth, if you make it there. And then if there's problems, and then it has to go to a NICU, you're talking another 3 to 4 hours to come over to Traverse City. So service delivery in the perinatal and maternal and child health world is a big, big challenge.
Hence the reason why so many people are moving here.
And you know, I know this presentation does sound a little wonky, But the truth is that the whole maternal and child health area is one of the reasons that it's so important, is that our infant mortality rates are really pretty high when you consider the Caucasian-only population across the state. And, you know, that gets where you live. When you have, you know, babies that are dying who really don't need to because there's access issues. And that's what this project is about, is really improving health status of all of our constituents across northern Michigan.
All right. Thank you both
Thank you
very
so
much, and
much.
thank you for
Appreciate
coming. All right. Next, Department of Human Services, Dawn.
Thank you for allowing us the opportunity to be here tonight. Our department...
Dawn, would you introduce yourselves, please?
I'm sorry, Dawn McLaughlin. I'm the County Director for Department of Human Services for Grand Traverse, Kalkaska, and Leelanau. And
Cindy Uli, Program Manager, Grand Traverse, Kalkaska, Leelanau.
I knew I was going to forget that part. We have a big mission. Our mission is to improve the quality of life in Michigan by providing services to vulnerable children and adults that will strengthen the community and enable families and individuals to move towards independence. We don't do that by ourselves. We do that with the help of our community partners. The health department is a huge community partner to us. And our vision is protection, compassion, and independence. So under our umbrella, we have a lot of programs that we run. A lot of our funding starts out with the federal government, and some of it comes through our department and goes out to other places in the community, such as Community Action Agency, Michigan Works. We contract with Michigan Works to help people that are receiving assistance find employment. That's moving them towards independence. We also contract with partners like Child and Family Services and Bethany for foster care services. And our work is carried out at the county level. We're in the state office building on Elmwood. For Grand Traverse, we have an outstation staff in Leelanau, and we have a county office in Kalkaska. We also have outstation staff at Munson Hospital, community mental health, and we're looking at possibly outstationing staff in the future at one of the elementary schools due to a project that we're working on with the court right now, and I'll tell you about that in a little bit. But Cindy's going to start out by talking about her programs. But before that happens, I just want to say that we're governed by a 3-person board, 2 of which you appoint, and 1 which is appointed by the governor. And we've had the privilege of having Commissioner Lemkel and Commissioner Max Bauer be county commission liaisons to our board. And we learn a lot, and just not only about resources, because you guys hear everything from everybody in the community, so we learn like who we can partner with to do a better job. And so we get county commissioner updates on a regular basis at our board meetings, and they've been very helpful to us.
The area that I cover is the assistance payments area, and you have a fact sheet, DHS fact sheet, assistance payments on there in front of you. So our department determines eligibility for and oversees human services programs, and the eligibility for these programs is based on group composition and financial factors. Some of the various programs that we have are the Food Assistance Program, also known as the Supplemental Nutrition Assistance Program, or SNAP, and this is a federal program designed to help people stretch their food dollars. So it's not designed to be their entire food budget, it's designed to help them, and they access that through an electronic benefit card. The Daycare Assistance Program is state assistance for families with young children who are working or otherwise unavailable to care for their children. And again, this is a assistance for them. It's not meant to be their entire daycare budget. They do have to pay a portion of it themselves. The Family Independence Program is federal and state funds supporting a cash assistance program for families with minor children in their home. And these individuals also access these benefits through an electronic benefit card. The State Disability Assistance is a state-funded cash assistance program for people who have been determined to be disabled by a team of medical personnel. Medical assistance is a Department of Community Health program. It offers assistance with medical needs like your doctor visits, prescriptions, and necessary health procedures. They can also sometimes help people pay their Medicare premium through this program. The State Emergency Relief Program is state and federally funded emergency assistance. It has quite a wide range of areas, but the most commonly used are for help with heat bills, electric bills, rent, and home repairs. On your sheet tells you the websites you can go to. The application process for all these programs can be done in person in our office with a paper application or online, and information can be found at www.michigan.gov/DHS. I also brought some facts from the Green Book for 2013, and the website is also there for you if you want that. These are statistics that are compiled by DHS and are available for public review. So every month we have approximately 17,000 Grand Traverse County residents collecting state benefits. 10 to 11,000 individuals are receiving food assistance. Over 14,000 are receiving medical assistance. Between 170 and 330 receive cash assistance, and 1 to 300 are helped with emergencies each month. And I want to apologize because I put monthly amounts first as far as the numbers, and then I switched, and now I have your dollar amounts, but these are yearly amounts, so sorry about that. So last year, over $434,000 was paid in cash to families with minor children, with an average monthly grant of $305. $14,900,000 in food assistance last year, $674,538 in emergency assistance. These state and federal dollars are spent locally on rent, daycare, food, and daily living expenses like heat and electric bills by the recipients. Workers in our county office have about 450 cases, and they receive new applications daily. Another program that I'm involved in is the Eviction Diversion Program. And this started, from April 2013 through December, we worked with about 200 people who were in court with evictions. We have 2 workers who rotate, taking turns to be in the courtroom on eviction day, and they try and solve the eviction if they can through our DHS programs. They work with Community Action Agency, Father Fred, and various other programs. The local program was begun by Judge T.J. Phillips after he heard about the success in Kalamazoo County. Barb Lemkuhl, our collaborator at the time, got a group of us together, and we went to Kalamazoo and we reviewed their program and saw what a success it was. So we came back here and we got a team of people together in the Traverse City area, and we've got a group going right now. So we've been working closely with Community Action Agency and people who are also concerned about the homeless problem in northern Michigan. The only thing we don't have that Kalamazoo has is financial backing, but we do have a group of dedicated individuals working hard to help the problem. DHS also handles adult services programs. We are responsible for investigating reports of abuse and neglect of vulnerable adults. Our staff do everything from making the initial contact to court procedures when necessary. Adults can be abused and neglected like children, and our community has a lot of retired people in the community with resources that make them appear to be an easy target for financial exploitation. And we've worked with the banks and prosecutor's office to resolve these situations with some great success in a few cases. Independent living services is another area of adult services. DHS can pay for services to help adults who need assistance to function independently in their home. So some of the services that the other groups were talking about can be paid through Medicaid or other DHS funding sources. The couple of committees that I'm involved in are the Eviction Diversion Committee, which has been very successful in the Traverse City area, and the Workforce Development Board, which, as Dawn said, works closely with Michigan Works to help people who are trying to get back on their feet and working again.
So we cover a lot of programs just on that part of our department. On the child welfare side, we have Child Protective Services. We are mandated by law to be the agency, now department, that child abuse and neglect gets reported to. We have a toll-free number for that. When there's a report of abuse or neglect of a child in our county, if it's determined that after some collateral contacts that it needs to be investigated, our staff go out and investigate it. If it's a criminal matter, they go with the police. And in the more severe cases, we might petition the court, remove the child if there's, or children if there's no other remedies available to prevent that. That's something that we try very hard to avoid because I consider that to be like getting surgery. Sometimes you have to get surgery in order to be healthy, but you're always going to have that scar and you're always going to have some associated things because of that. So we take removal of children from their homes very, very seriously. And in our counties, we have slowed the process down by not only having a supervisory review, but a second tier management review. When we have to remove children, we look at relatives placements, and we do very exhaustive searches to find relatives. We check relatives out and try to make sure that they have the assistance that they need in order to support the children. And then we have a foster care staff that work with those children and their parents to return the children home eventually. In some cases, when that's not possible, we petition the court for termination of parental rights, and the children go to an adoptive family. Last month in January, we had 77 children in care in Grand Traverse County, and they are with our private agency partners. Some are with DHS foster homes because we do license homes ourselves too. Last month there were 130 complaints to our Child Protective Services staff, and out of those we investigated 64, and out of that we determined that there were 32 child victims. We also are responsible for the juvenile justice program, which is delinquency. If the courts commit them to our department, then we're responsible for providing services for them. And we also no longer do adoptions because that's contracted out to private agency services in the state of Michigan. But myself as a county director, I have to approve all of the adoptions that are expedited, which means they don't have any issues that would come up that would be unclear, and those go to the state level. So we have a pretty big job, because when you think about child welfare and child safety, that's something that our whole community needs to be engaged in order for us to be successful. So one of the things that we do with our community partners is that we do a lot of collaboration. I'm on the Child Advocacy Steering Board. I used to be part of the Child Abuse Prevention Council. I go to the Human Services Collaborative meetings. We cover 3 counties, so we take turns who goes to what area. And I also serve on the Child Death Review Team, which our health department partners are on. And I don't know if you're aware of this, but for every child death in the county up to age 18, there's a Child Death Review Committee with the medical examiner that reviews these situations. And the purpose of it is for prevention, to see, for everybody to come together and be able to share information and say, this is what we knew and were we involved, or this is what another agency like the health department knew, and say, what could we have done differently, if anything. But these don't all involve child abuse cases. It is any child that dies of any cause in our county. And so we're looking at patterns, and we're looking at best ways of intervening in those patterns, and those can be car accidents. They can be child deaths in daycare or infant deaths. And our department has taken a very serious stand on infant mortality, unnecessary deaths of children. Most of us grew up where it was perfectly okay to take your child into bed with you, especially if you had a new baby. And back when I did Child Protective Services in the mid to late 80s, we had a lot of sudden infant death syndrome, which they call SIDS, and we had a lot of kids dying and we didn't know why. And then we started looking at something called maternal rollover, which meant that sometimes the mother would roll over the child while they were sleeping. So we've learned a lot since then, since I started out in child protection till now, where the governor's wife and the head of our department, former Chief Justice Maura Corrigan, have taken this on personally, and they came to Munson Hospital this year and worked together with Munson to try to get the word out to people that it's no longer okay to have these unsafe sleep practices. And this has changed so many times just during the course of the last several years that sometimes it's hard for me to remember what is the correct safe sleep practice. But now you shouldn't have any blankets or toys or anything in the bed with the child. The child should be in a crib. The child should never be on a couch, should never be in a bed with a parent. And so we're involved with community partners and things like that. We do a lot of collaboration with the other parts of our department. I'm on the Michigan Prisoner Reentry Steering Team. What we do know about people that get out of prison is that most of the people that go into prison, most prisoners, will eventually be released. And so when they're released, you want it to be okay for them to be safe in the community. In order to do that, they need a job and they need a place to stay and they need food, or they will end up back in prison. So there's a whole group of people that are involved in the Prisoner Reentry Initiative, and DHS is just one partner in that. On the Child Advocacy Board, our board was granted a very generous donation, primarily a donation. The CAC has to come up with some of the money, but there's a building on Hartman Hammond that there's a coffee shop there. I don't know if you're familiar with the ice skating rink and where the Wings play, but it's a very nice building, and that was donated to the Child Advocacy Center. And what the Child Advocacy Center does is they have a child-friendly place for if a child is suspected of being sexually abused, they can go and be interviewed in a safe setting that's child-friendly, and there's family support for the family members, and there is our staff participate in that, law enforcement participates in it, and then the child advocacy staff participates in it. Our department's been involved in the Poverty Reduction Initiative in our community here since it started. We continue to participate both on the steering team as well as individual committees. I was on a committee for impacting poverty by looking at people that didn't graduate from high school, because we know that people that don't graduate from high school end up being poor, or if they get pregnant before they're adults, they end up being poor. So we know some of the things that impact that. And Traverse City Central, as a result of that small poverty reduction subgroup, ended up starting a mentorship program for kids that were at risk of dropping out, and their principal took the lead on that. Our department as a state level, has partnered with the court system because they view people in prison many times do not have a high school diploma, and they have discovered through a lot of research that the truancy that happens if it's not caught early, or if you're expelled one time from school, that increases your risk of not graduating from high school. So our department, along with the court system and the ISD, is in a partnership, a 3-year partnership that started with the summit in Ann Arbor this spring to work on local outcomes for helping kids graduate. And one of the things that they taught us is that what used to happen when we were kids is that if 2 boys got in a fist fight at school over a girl, they'd be sent to the principal's office and they'd be told to shake hands and make up, and that would be it. When the zero tolerance law went into effect, all of a sudden it criminalized a lot of that behavior. And when they did that and they started having people arrested instead of going to the principal's office, and it started going before the court, then that really changed their ability to be successful in school and end up graduating. So we're in a partnership right now in our community where we're impacting that. Because our department's ultimate mission, like we had talked about at the beginning, is we want people to not be in poverty. We don't want people to be abused, and we want them to be successful. We'd like to put ourselves out of business at some point. Part of what I'm now engaged in is, and you might have heard about this, is the 5-to-1 group that is formed for the Great Start Collaborative and early education. And they'd like to do, in conjunction with our department and all these other really great community partners, the Chamber and NMC, the schools, is to come up with some community centers for families where there's one-stop shopping and no wrong door. And we've been talking about that for years, and this group looks like they might actually do that. We also have started a baby court model here that I had discovered Genesee County was doing that, and we invited community partners to the table, and we now have a model where we look at what happens to kids when they go into foster care, how we make that transition, how we can keep attachment with kids with their parents while we're working towards reunification. And so we're learning things from infant mental health specialists about a child knows they're safe when they can smell their mother. So now if we remove a child, we're looking at taking an object that smells like the mother with the child into care. We also bought some recordable Hallmark books so that the birth parents could talk to the child even though the child is not with the birth parent. And we're trying to supplement our visitation right now with technology. We have a pilot group going with our partners like Holy Cross, Bethany, Child and Family Services, and Catholic Charities that provide foster care for our area to do a FaceTime project so that kids in foster care can communicate with their parents and vice versa. And from my perspective as a grandparent, I've been able to form an attachment with my grandchild who lives 2.5 hours away by doing Skype or FaceTime. And I'm not a technologically proficient person, but he even knows, and he's not quite 2 yet, how to press the right buttons on the phone to send me a FaceTime message, which he did today when I was at work. So we're trying to stick with our mission of being compassionate and helping people and at the same time, making sure that people are protected. And sometimes that puts our staff in tricky positions because they have to be social workers and investigators at the same time, and they really do a fantastic job. And on Cindy's side, where there's the eligibility side, it's traumatic when somebody doesn't have food and you cannot help them the same day. And so we rely on some of the money that the county has given our DHS board, and our DHS board decides how that money is spent. But they've allowed us to spend that money for some emergency needs that our department wouldn't otherwise have. And we're really grateful for that. And then if there's our presence in the community is an ongoing, based on what the needs of the community are and the ever-changing aspect of our community. So we're involved in HelpLink because what people in poverty have to do is piece together their resources. What we find is that they'll go to our office, they'll go to Father Fred, they'll go to Salvation Army, they'll go to Goodwill, and HelpLink was started so that there could be kind of a one-stop place that they could go. So our staff are available to the HelpLink staff so that they can find out what resources we have to bring to the table, and then the other resources can be helped with other community partners. There are people, unfortunately, that do fraud our system. And our department has taken a very strong stand on this. And we have an Office of Inspector General located in our office. And our staff make fraud referrals when they find that there's fraud occurring or when they suspect it, and it gets investigated. And I don't want to leave you with the impression that most of the people that we serve are going to fraud. I think it's a small percentage of the people we serve, but we don't want them to take away benefits that should go to other people. So with that, did you have any other thing? No. With that, I think I'll just, if you have any questions, feel free to ask, or any concerns, anything you want to bring up.
Dave?
Just a quick one. On foster care caseload ratios and how much of our caseload is in private agencies?
Well, we're supposed to, by state mandate, we have a certain percentage that has to go to the foster care private agencies, but we are nowhere near, I mean, most of our cases end up going to private agencies when they're available. One of our goals this year was to increase the number of foster homes that were licensed. And if you have any ideas on how we can reach out to do a better job of that in the community, we would really like to do that. We've had campaigns both with our private agency partners and our department to try to get more foster parents. It is a rewarding experience, but the reimbursement rate is not high. And so people are doing this out of the goodness of their heart. They're not doing it for money. And there's a lot of challenges with being a foster parent. So we appreciate any family that's willing to make room with the goal of returning these kids home to their birth parents, because they're always better off if they can do it safely that way.
I'm not, excuse me for not being familiar with all the, what's going on in your world, but where are the private agencies located? Are they here in Grand Traverse County, or are they outside of the county?
Child and Family Services is located right on Veterans Drive. Bethany is located on Garfield.
Okay.
Catholic Charities is new to our area, but they have opened an office here. And Holy Cross also has had an office here for quite some time.
That's good.
Yeah.
Yeah, because the county I came from, they didn't have a lot of, in fact, they had no agencies inside the county, so that if some kid was put in foster care in a private agency, their caseworkers, I mean, the kid, the family had to go somewhere else. I mean, there was just a distance factor that came into play, and
yeah.
So they were very much opposed to it.
Yeah, and I personally, as a county director, have to sign off on any child that goes 75 miles or more away. I have to personally sign off on any siblings that are separated from one another. I take that responsibility very seriously. I came from a big family. I love my siblings. And I think that that's helped kind of, when we're in the crisis mode, try to slow things down so that we can make really good decisions, like have people that aren't in that, where you're out with the police and you have to remove a child to slow it down to try to get more information. And that's really been helpful. I think we've been doing a good job of that. Our goal is to place the child with the family that can best meet that child's needs. We don't want children to move from foster home to foster home. We consider that a big failure when that happens. And we've all been getting ourselves more trained and involved with trauma-informed treatment of children, because basically children that act out their anger and rage, it's usually fear-based. And we are getting some training through community mental health on getting people to understand that when the child feels safe enough in your home, that they're doing something destructive, that could be a good thing, that they trust you. And so how to take that and understand it and keep them safe in that home and not say, oh, I can't do this anymore, they're going to have to go to somebody else. So it's a challenge, but we have good community partners. We have this community is known for its collaboration with, it's outstanding collaboration. And like when Cindy was talking about the eviction diversion program, when we went down to Kalamazoo and looked at their program, they had a lot of foundation support. They had money. They had a lot of money. We did our eviction diversion program with no money. We just made the decision, we're all going to provide this. We're all going to get together and work on it and do it. And we're not spending money on staff or, new things happening. Our staff are outstationed at the court 2 days a week. And I think that's why I'm proud to live in this community, because I think that this community is outstanding for this kind of stuff. So.
Dawn, you talked briefly about adoptions that go out to private agencies.
Yes.
Like Catholic Human Services, are those the private agencies that you're talking about where children are placed into adoption?
Any private agency can do an adoption if they're licensed to do that. Usually, when children go into foster care, hopefully, if there's no relatives available for adoption, that foster home will adopt them. So let's say they were at a Bethany foster home, then hopefully the Bethany foster home will continue on with that adoption.
Okay. Any other questions for Dawn? Commissioner Lemko?
I just, I thank you for recognizing the collaboration that happens in our community, particularly for the Collaboration Council that you're part of that organization. And I know they've done a lot of good things. And, we've talked about our dues of $5,500 a year, which covers all of our departments, becoming part of that organization. And this is just one of the things that they picked up and brought to our community that's making an impact that doesn't cost us any money. And so they have been able to use those resources. The other thing is HelpLink. Putting that together has taken some of the pressure off from the Department of Human Services so that people have somebody to talk to. So they can really be able to say, somebody else cares. And that's more often, that's all they need, is to know that somebody cares, and it gives them hope, and they can be able to figure out how to get the resources and be able to get themselves on their own feet.
And I think that's very helpful, because we're going more to a call center online process, because we have so many people at this time in our history of our economy that need help. And so we have less face-to-face time with people that are in those circumstances. So anytime that they can actually come in contact with somebody that has the time to sit down and explain things to them. But not only that, I think that collaboration leverages a lot of money. And that is really important, because it's like the court couldn't have done eviction diversion on their own, and we couldn't have done it on our own. But together, having that collaboration, we're doing it, and what happens when people get evicted is that their children get evicted too. So most of the people in evictions are children. That means that they have to change their school system. And they also have to move in with families that they don't know. And whenever our families move in with people that they don't know, they are at risk, serious risk raised for child abuse and neglect. And so having that kind of collaboration that has historically existed here without money, and pooling resources and knowing what each other does so that we can all tap into it together, I just think has just been very beneficial. And I've worked in 9 different counties, and this county is very outstanding. So you all have a lot to be proud of.
Any additional questions for Dawn? Thank you both for coming.
Thank you for the opportunity.
All right. Next on the agenda is unfinished business, and there is none. Under new business, I listed joint meeting with the Commission on Aging Board. Is that okay with everybody, that we have a joint meeting with the Commission on Aging Board on our schedule? Dave?
I think the question was, and Chris Kramer asked me this question, did you want the budget meeting to be together at the
Yes.
same time as the joint meeting with the COA, or do you want
Yes.
them separate? Because we're doing them separately with the Parks Board.
Together.
Okay.
All right.
Looks like you got a lot of head nodding.
What's the purpose of this joint meeting now?
It will be the standard budget presentation. Georgia answered our questions, as I understand it today, and sent it out to her board, the answers, to prepare them for our joint meeting to discuss the Commission on Aging's budget.
And when will that be?
It's on our calendar that Chris Kramer sent out today.
You don't know when it is?
Oh, hang on a minute, I can look
I
at it.
can find out.
Where's that meeting tomorrow?
Next door at 6 o'clock.
Hang on here.
Okay.
February budget calendar. Just a second, and I will be able to give you the date.
It's not
It will be Friday, the 14th of February. Okay? All righty. Okay, this
Chris
is...
sent out a new calendar so that, because I said I don't think I received it, but just so you got an idea that on the 7th is District Court and Community Corrections. And then on the 12th will be the Health Department soil erosion. And then the 14th we'll have County Treasurer and then the Commission on Aging Senior Center, which will be a joint board.
Okay. We have scared off all of our public, but this is our second opportunity for public comment, if anyone would like to make any. Seeing none, Commissioner committee reports. Commissioners, any committee reports?
Hearing none.
All right, I have one. We, at the Commission on Aging Board, have received a resignation of a board member, and so I would like to put the Commission on Aging board opening on our agenda for RM&A, which I believe is the appropriate committee for discussion.
As to whether or not we want to appoint somebody
Yes.
or downsize their board.
I
That
thought
could
we
be
had
one
too
of our
many people on the
discussions.
board.
I
I heard from you forever.
So we'll have that discussion.
Just for your knowledge, the Commission on Aging Board did vote almost unanimously. There was one no vote to replace this board member.
How many
All right.
members are on that board?
11, 12,
12, I think.
12.
12.
Yeah.
Think there's enough?
We do the whole county with 7.
That's my point.
Yeah.
Let's not replace, let's lower.
Well, you're in disagreement with
Well, we can
a
be
different
So what?
Commissioner Rennie on that board.
That could be, but I'm not looking for those kind of battles.
Okay.
Yeah, well,
But I think it's our board's choice to make the size of their board, is that correct?
Yeah. And
Yes.
Whatever, it should be an odd number.
And that too, exactly, good point.
Well, RM&A for discussion is the appropriate committee. Moving on. Notices and/or announcements.
I know this is at 7:30.
Mr. Benda, I'm assuming we do not have a closed session.
We do not.
All right, I would entertain a motion to adjourn.
So move.
Let's stick
All
around.
right, moved by Commissioner Rennie, supported by Thomas. All those in favor say aye. Aye. We're out of here.